Well, last week we covered the first 5 little-known facts about varicose veins that even your GP probably doesn't know. In this video, I'm going to cover the next 5 little-known facts about varicose veins and thread veins. Now, hormonal changes do have an effect on the veins. We know, for example, that during pregnancy, the veins tend to relax to accommodate the increase in blood circulation within the pregnant mother. So, varicose veins and thread veins do tend to deteriorate during pregnancy, partly because of a hormonal response. And this has led some people to say, you shouldn't really take birth control pills, the oral contraceptive pill, if you have a family history of vein problems or if you have varicose veins yourself. Well, I don't think that's right. I think it's more important that you take the oral contraceptive pill to prevent pregnancy, but be aware that sometimes these sorts of medication, the oral contraceptive pill, hormone replacement therapy, can aggravate the condition if you have an underlying problem. But it's no reason to stop taking HRT or the contraceptive pill. The next thing to tell you is that you don't have to now undergo painful surgical operations such as stripping in a hospital under a general anaesthetic. We have specially designed treatments now that can be performed on a walk-in, walk-out basis under local anaesthetic. Not only are they more convenient and less dangerous than treatments under general anaesthetic, they're associated with a much quicker recovery. They are associated with a lower recurrence rate, that is the risk of vein problems coming back again, and they are associated with much better cosmetic results. The appearance of your legs is much better after these new treatments than with surgical stripping. Surgical stripping is dead. It shouldn't really be performed. I haven't performed surgical stripping for many years now. With modern treatments using ultrasound guidance, I can treat nearly any vein problem without resorting to surgery and certainly without resorting to general anaesthesia. Now, the next thing to tell you is that it isn't just women who get vein problems. Men get vein problems as well. And in fact, if you look carefully with ultrasound and you do carefully controlled studies, you'll find that almost as many men as women are affected by vein problems. So if you're a man and you've got aching, throbbing legs which tend to swell at the end of the day, you may well have a vein problem. And just because you're a man doesn't mean that you can cross veins off your list of potential problems. Now, lastly, there's a lot of confusion about medical stockings. Should they be used to treat varicose veins? Do they help the condition? Well, it's fair to say that medical stockings, which are a particular sort of stocking, they're much firmer at the ankle and then become progressively less firm as you go up the leg, so they're graduated. Medical stockings do help the reflux whilst they're worn, and so whilst you're wearing them, they will provide symptomatic relief. So they're not a cure, I'm not suggesting they are, but if it's not convenient for you to have vein treatment or if it's something you're not considering, wearing compression stockings will help the symptoms. They'll also reduce the risks of deep vein thrombosis on a long journey or if you're going into hospital and having major surgery. So they're anti-DVT. And also, something to bear in mind is that if you have had a complication from your veins, such as a deep vein thrombosis, then the wearing of compression stockings will reduce the risks of an ulceration. So there are good medical benefits from wearing compression stockings, but they don't cure superficial vein reflux and they're not a cure for varicose veins. Now I hope you've found this video interesting and that you've enjoyed watching it. If you have, do please remember to click the button above and subscribe, and that way you'll be amongst the first to see my next video. If you have any questions, do please leave them in the box below. That way I'll get back to you as soon as I can. Thank you for watching my video.